Good afternoon, everybody, and welcome to the Leading Mindfully webinar podcast. I'm Bryan Welch. I'm the CEO of Mindful Communications, and it's my honor and pleasure today to be spending this time with Steve Klasko. He's the head of the Jefferson Health Systems in Philadelphia. It's one of the nation's largest network of hospitals and health facilities. It is soon to have about 52,000 employees, and at that time, after a couple of upcoming mergers, will be the largest employer in Philadelphia. Steve, welcome. Thank you so much for taking the time to spend with us.
Thanks, Brian. I'm frankly, as somebody who spends a lot of time in the tech world, I'm excited to be talking about humans.
Yeah. Yeah. Well, let's hope we can make it more interesting than the usual tech webinars. That's one of our goals that for all of these things. I would think the past year, talk about interesting, the past year in healthcare must have been a pretty interesting passage. How are your people? How did it go through this pandemic?
It really was, for a place like Philadelphia, almost a trifecta of leadership challenges. So at Jefferson, we had the most number of COVID patients of anybody in the state. About 20,000 people were hospitalized in our hospitals. If you think about it, we had 35,000 employees. We didn't lay off or furlough even one. And in fact, we actually came up with a fund to help our most vulnerable employees. We had a great supply chain situation, so we had one of the lowest employee infectivity rates, but we were also dealing with the social justice issues with George Floyd murders. We were in the middle of that in Philadelphia. We're a very diverse city, and Jefferson's located, the main hospital, right in Center City. We're dealing obviously with the elections and the voting rights, and so many of our patients and students were involved. I'm also the president of the two-campus university, so dealing with a Black student union, for example, of 17-year-old folks of color that are really questioning a lot of things, and then dealing with the financial issues and the leadership issues, and frankly the burnout and post-traumatic stress syndrome. So we think a lot of BC before COVID, DC during COVID, and we've come to think of now as KAC, kind of after COVID, because we don't really know when real AC happens.
Yeah. And so the burnout issues, the stress issues, how does an organization the size of yours even start to address that during a period like this?
Well, I think the first thing I'd say is you almost have to reverse your organizational structure. As complex as we are with two-campus university and 14 hospitals, we needed to show vulnerability up top and really get everybody to participate. So in this case, I was taking more cues from the people that were on the front lines than I was from my senior leaders, because they were the ones that were most involved. Also, and this might sound funny, Brian, but we needed to inject some fun into it. So, we invested $35 million in telehealth back in 2013, back when people thought we were crazy. Obviously, it made a big difference during this pandemic. We went from 100,000 visits between 2015 and 2020 to 100,000 visits in 2 months in March and April.
That's over telehealth, you mean visits?
In telehealth, I'm sorry, in telehealth visits. And they came to call themselves the Night's Watch. For those of you who have watched Game of Thrones, they were the last vestige against the White Walkers. I started my career, Brian, as a DJ, and every Friday I would send out a playlist to our 35,000 employees that became a thing. And we take different topics. It might be like, all right, dating during the pandemic, and we use Roberta Flack, First Time Ever I Saw Your Face, because you're having to date virtually with masks and that kind of thing. So I think and so what started to happen is my employees started to come up with songs that were based on some of the things that were happening. We won a contest and ended up on Ellen, the Ellen DeGeneres show, because Sia had done this thing for her song Level Up. So our nurses did this dance that ended up winning. So the key of really trying to take what is a horrible tragedy, but also make sure that we were recognizing people's contributions. And the last thing I'd say is you also had to reverse some of the scripts. So the traditional thing during a crisis would be that myself as a CEO would be out in the emergency rooms and out in the halls and talking to people. And since I don't practice anymore, I'm an OBGYN, since I don't practice anymore, they were very honest and said, look, Steve, we have really, really, really precious PPE. We'd love you to, come, but frankly, you can do more for us, up in your office and doing things virtually for us, and than just having come and using a mask and using a shield and that kind of thing. So some of it is sort of recognizing that you have to do the right thing and not just do what it says to do in the books.
What did you learn when you went to the rank and file during this particularly intense period? You said that you sought out people at the front line to give you guidance. Evidently, part of the guidance they gave you is that keeping some fun in the workplace is important. Were there other key learnings that came from those conversations?
Yeah, I think one of the things was, look, we know the health system's losing lots of dollars like everybody else. You've always taught. We changed our mission, by the way, Bryan, to from what most academic medical centers' missions are. We want to be the premier academic medical center in Philadelphia or Boston, which really nobody cares about other than you and your mother, and nobody can even define that. So we changed ours to we improve lives. And we have 3 values: do the right thing, put people first, and be bold and think different. So, basically, I think our frontline people challenged us on those 3 values. So look, Steve, we want to know you're always going to get us, premier PPE. So we never got any KN95 masks because they said, look, you're going to improve our lives and we're in the front lines. It's no different than being in a war, and getting us the right, bulletproof or IED-proof vests. I mean, we're literally in that situation. So we never skimped. I'll give you an example. I'm sure you've seen those things nationally, the people wearing trash bags and gowns that were, that were made in other places. That's because gowns went for a period of time from 11 cents a gown to $20 a gown. Now, Bryan, to put that in perspective, we use 15,000 gowns a day. So you can do the math of what that meant. But we never, ever changed our gown policy or changed the gowns that we bought. So you can imagine the impact that had. But on the positive side, the workforce really appreciated the impact it had on that. And by the way, the outcomes were that. The average in this country of employee infectivity rate, somewhere between 3 to 5%. Ours was 0.8%.
Wow.
So,
that's incredible. Yeah. For anybody who doesn't know, PPE refers, I think, to personal protective equipment.
Yeah, I'm sorry. Yeah, that would include masks, gowns, shields, everything. And, one of the interesting things about this that, and I think it's really important for the mindful audience is if you look at this as a war, this was the first war that you took home. So if you're a nurse, working in our emergency room, last March, April, May, June, you're putting yourself at risk, and then you're going home, and the advice was don't play directly with your kids because you don't know what you're bringing back. So literally, we have folks that were literally playing with their kids across screens, and that kind of thing because they felt guilty not playing with their kids. They felt guilty. What if I infect my kids? Remember, that was before we had some of the really good COVID testing and that kind of thing. So, the amount of, for lack of a better term, both during COVID stress and post-traumatic stress disorder that we'll be seeing for quite a while is really key. And then as a president of a university, I was dealing with, young people that were missing all the interactions that they were having. If they were on the bubble as far as any behavioral health issues, often they went to the whole other side of that. And then again, if you deal with, as we have a very diverse student population, the George Floyd issues, the social justice issues, there was a lot of tension and a lot of folks wanting to know, what we were going to do to ease that tension.
And what did you do?
So, well, the first thing I did is talk about what we can and can't do. The second thing we did is we just invested millions of dollars in customizing behavioral health opportunities. So just to give you an example, I mean, and you can imagine with this complex an organization ranging from 17-year-olds, and as students to folks that have been working at Jefferson for 50 years. So for the students, one of the interesting things that I think you'd be interested in, Bryan, is for many of those students, especially a young person of color, they would rather talk to a bot that looked like them than maybe a psychiatrist or psychologist that looked like me. So we started to work with some of the tech companies that were creating those kind of opportunities. On the other side, we offered full psych telehealth opportunities, but really almost asked everybody to access them, even if they felt okay.
Yeah.
So the key was, and you guys are big proponents of this, is don't wait. Just like you don't wait until you've had 3 days of chest pains. Don't wait. If you've been in the ER for lots of days, you are going to have some psychological manifestations. So even if you don't think you need it, please do that. We it was before I got very involved with mindful, but we took some of the things from your books, A Start Here and that kind of thing of meditation. We brought in some folks like that, and as you can imagine, some people embraced that, some people didn't. But really, what I send out a letter every Friday, and it's directly from me to the 35,000 employees, and I try to make it almost very personal. But one of the things I kept telling people, whatever you enjoy, make sure you're trying to do that, for a few hours a week. If that's yoga, if that's running, don't let this kill that, because that's where things really start to go awry. So I think
Sorry.
So I think people really took that to heart, and I would ask people to tell me their experiences, what worked and what didn't work, and then I would share them, with the rest of the employees.
It sounds like you made a study of meeting people where they are. Whatever the activity is that alleviates their stress, whatever the concern is on their mind. It sounds like you try to provide a way for them to address all of those or any of those things, depending on who they are. Is that super difficult when you're dealing with 30 to 50,000 people?
Yeah, I think it is. The good news, Bryan, in a way, is we had started to recognize that with our patients. This whole issue of consumer segmentation has escaped the healthcare industry. And what I mean by that, like, my brain explodes when I see a billboard someplace that says, Pleasantville Hospital, we are patient-centered. Well, are you patient-centered for a person like me, a 67-year-old with an Oura Ring and an Apple Watch that will count steps, and try to compete with you, Bryan? Are you patient-centered for a 36-year-old disengaged person that really doesn't care about their health unless something bad happens? Are you patient-centered for a 76-year-old with cancer that really only looks at Facebook to see their cute grandkids? You can't be, so it's easy to just say I'm patient-centered. Amazon has 1,987,000 types of us. So at least at Jefferson, what we had done with our patients is tried to get into that consumer segmentation game. And that gave us a heads up, because it gave me a chance to look at my employees in that same sort of employee segmentation range. And that's why getting that feedback back from them, I would ask people, what's getting you through the day? And so people would say, well, you know what? I really never really ran a lot, but I ran in high school, so I started to run again because that was safe, et cetera, et cetera. So, I said, all right, for any of you, look, running might not be for all of you, but for any of you that have had a thing of running, why don't you make a plan to do a virtual 5K or a virtual 10K? And I put out some of the things for there, and I incentivize for folks to do that. And then some people would say, hey, I found that, I took up, it could be knitting, and I was going to knit or jigsaw puzzle, whatever it was. I said, that's a great idea. And then why don't you, for the next Friday letter, tell me what jigsaw puzzles were the coolest ones that you've done, so I can share that with people. So it wasn't judgmental And it wasn't like, oh, I'm a marathon runner and that's what you should do. Or, I do yoga or meditation. But we tried to get other people that worked, not me and not my senior people, saying, this is what worked for me and this is why. So that people could start to relate and fit into one of those.
For sure. We refer to what we do at Mindful very often as self-actuated mental health. And it sounds like what you were doing is opening a lot of doors for people to allow them to self-actuate their own mental health to the extent that was possible. Is that a fair way to describe it?
Yeah, yeah. I think it's, yeah. I mean, for me, it's really um, putting yourself. One of the things I learned when I went to Wharton is that the best negotiators, the best leaders, always think about what the other person wants and try to get that to them at the lowest cost to yourself, as opposed to, well, this is what I want, and I'm going to be And I think some of that is the same thing when you're being empathetic for a large workforce, is trying to think about, if I was coming home to two kids and had been working in the ED or working in the labor and delivery room, what would I want from my leaders? It's very different than what I needed, and I felt that I could figure out some of that, but I really needed them to tell me, and maybe the self-actuation is giving them permission. I would argue it's more self-permission to say, look, tell me what I need to do to help you help the organization. I don't know how many helps that is, but and it's giving permission to, first of all, that people know that I'll listen to it. And almost, so when I would do my Friday letters, I would probably get 50 to 100 emails back, and I answered every one. It was something I would do on a Sunday, because I would send them on Friday, and my communication people would say, here's all the things that came in, and some would be thank you so much. These letters, really helped me to, hey, you should think about this for a song, and I'd answer every one. And then some people say, hey, for your next Friday letter, you should suggest doing this, and this. And I'd say, well, Marcy from Abington Hospital had a great suggestion. Thank you very much, Marcy, of incorporating, music into your yoga routine, or whatever that was.
Mm-hmm. Were there systemic things that you were able to do in the organization that opened up these opportunities for people? I mean, we've talked a bit about the communication channels you opened, which sound very useful and exciting, and a very, a great innovation. What about things, in terms of how you allocate hours to people? Were there other things you could do that would give people a little more flexibility or whatever they needed to stay healthy?
Yeah, so one of the things that we did is anybody that was on the front lines that was feeling stressed in any way, we gave them the opportunity to go, and be the Night's Watch and the Game of Thrones and our telehealth piece.
Oh, and switch out to telehealth.
Yeah, and then sometimes some of the people in telehealth said, well, and what was amazing, Brian, is when you have a mission of we improve lives and people believe it, the way they took care of themselves is really unbelievable. We had this one emergency medicine doc whose child had leukemia, and the Night's Watch folks demanded that she leave the ER and work telehealth, and they would cover her things because look, you have a child that's immunocompromised, and even though you're taking all the precautions, you just shouldn't have to do that. So they just basically volunteered to take her things. They didn't make a big deal out of it. So I think that's part of the self-actualizing also. If you're, I think if you're sending the signal that you're an organization that cares and cares for each other, then you start to recruit those kind of folks, and then that becomes the norm. And if you have a mission that says we improve lives, and values that say put people first and do the right thing and be bold and think different, then I think you have a lot of that happen. So to me, it's a little bit like starting the generator. Like some of the things I mentioned, we started the generator, but a lot of the things, like even the thing like the practicing for the level up and getting on the Ellen DeGeneres show, we're all self-made. And they said, Steve, as a DJ, wouldn't it be cool if we won this? And they knew that as a music guy, I would think would be awesome. And we sponsored them and did all that kind of stuff. But most of the stuff did not come from us. Most of the stuff came from folks on the ground that we gave permission to do it, that they knew we listened, they knew that we disseminated it, and we knew we made it easy for them. We also, at least among our middle level and senior people that were also working 20-hour days, we sort of demanded that they take a day off, and really just do something more creative, even if it was going to be work related, go and write a paper, do something that isn't, this 3 times a day, just, war room type stuff, which is where we were at for a while in 2020.
Can you afford to do that? I mean, you must have a very heavy bottom line responsibility in an organization like yours.
Well, the answer is, the nice thing about being a large not-for-profit is we're not dealing with quarterly earnings. So, there was a point where it was really challenged. There was a point where we lost $1 billion to our balance sheet. We weren't doing elective surgery, when we were getting all the top flight PPE, when, insurers were paying us for COVID patients that might cost us $120,000 and, paying us, $10,000. And
you're serving some of the poorest parts of Philadelphia, right?
Yeah. And in fact, right before this happened, Bryan, the hospital that serviced the poorest people in Philadelphia, called Hahnemann, had just gone bankrupt. It was owned by it was a big deal nationally, owned by a VC guy and his wife, and it just gone bankrupt. We got 60% of those patients, and they were uninsured, underinsured. That about 3 months before the pandemic. So yeah, I mean, we were really challenged, and I think, my board supported us doing this, believing that we'd get out of it. I'd be lying to you if I didn't tell you that there were, board members and senior managers that thought we should, at least think about furloughing some of our employees like everybody else did. And we might have had to if things didn't, rebound, et cetera. But I think, the core of our team felt that by doing the right thing, it would come back. And I think by and large it has. I mean, we're well ahead of our budget this year. It'll take a while to totally get back. But as I said, at a time where there's a turnover tsunami of healthcare workers and other people just taking different jobs, I think we're doing better than most.
Do you know the numbers for that? I'm just curious what the comparison might be.
Yeah. So, I mean, I've talked to some of my colleagues who have told me there's about 30% turnover, and, we're probably in the, 15 to 20% range. So, it's certainly not what it was before. But look, I mean, there's a lot of reasons for it, right? There's people that are, tired of healthcare. There's people that are just, hey, life is short. Like I thought this was the end of the world, or I got COVID. And if you're 60, I got 20 more summers. So I was going to work another 5 years and then retire. But, what the heck? Young people saying, I'm moving to Austin and, I'm just going to move to Austin and find a job. I mean, by the way, that's happening even in the VC world. I do a lot of work with General Catalyst and, those folks. And, those folks are moving many of those folks are moving from the Bay Area to Austin and Miami, and telling them, hey, you want me to continue to work for you, I'm going to do it from Austin to Miami. And by the way, if you don't like that, I'm sure I can get a job. I'm a software engineer with 3 degrees from MIT. I'm sure somebody will allow me to do that. So I think, the tsunami, like any tsunami, there's 6 or 7 factors, Bryan, that are all coming together, that are making it, really interesting. But it starts with being flexible, adaptive, creative, and nimble with your workforce, I believe, and having them believe that you care about them because you do. Right? I mean, it's got to be, I think people are very, very, very good at knowing when things are sincere and when they aren't.
Yeah, I hear that, and I hear the work you're putting into creating a culture where up and down the organizational chart, people are being taught to care about people. That seems to be a central message of what you're doing.
Yeah, I think one of the things about culture, I'm glad you brought that up, because you can't you can't establish that in a crisis, right? I mean, I think that's true of wars. That's true of great businesses like you're running. It's something that Eric Lankshire and I have talked a lot about. And we had started something called JOLT when I got to Jefferson in 2013. It stood for Jefferson Onboarding and Leadership Transformation. I'd been involved with Apple when it moved from a computer company to a digital lifestyle company. And I took a lot of it from that. But one of the interesting things we did, for those of you who are listening who have been involved in healthcare, we did a national study. And if you look at docs, especially docs like myself, 20% of your docs in your health system will get it. They get where you're going. Steve, I love this telehealth stuff. 15% will never get it, and there's 65% in the middle. What we found, Bryan, is as leaders, we spend 40% of our time with the docs that get it, because they like us, we like them. They tell me how great I am. They want to play golf with me. We spend 45% of the time with the docs that'll never get it, because they're loud and we can cure anybody. And we spend the least amount of time with the people in the middle to change your culture. So we did at Jefferson. We wrote this up for Sloan Business Review. We did Jefferson says, look, we're going to spend less time with the folks that get it, have them become the mentors, to teach the teachers thing, because they can sort of go on their own. We're going to ignore the folks that'll never get it. We call that administrative hospice. We're just going to let them be comfortable, and then we're going to concentrate on that 65% in the middle. So, and what's happened over 5 years, we've gone from maybe 40, 45, and 15. I mean, from 20, 25, and 15 to 45, 40, and 15. And that's where you start to change the culture. So when this pandemic happened, we had that core group of 45 people. So somebody asked, I said it quickly, JOLT is Jefferson Onboarding and Leadership Transformation.
Yeah, Tim Peter Strickland answered the question for us.
Yeah.
Thanks, Tim.
Yeah. So, and by the way, that 15%, and not being trite about the administrative hospice of going away, a lot of them did go away. If we were lucky, they went to competitors, because they're not going to, they're not going to be the people that matter. And by the way, a lot of folks from other places came to us because of that attitude and that mission change. So, I mean, think about this. We're an academic medical center. We're in a city with Penn and Temple and other great academic medical centers. And if your president's goal is to be #1 in NIH funding, and you're building a large telehealth or a large health equity piece, et cetera, and now the competitor to where you're at is saying, we're all about improving lives, really looking at how technology can not just make the wealthy healthier, and really getting involved in health equity. And we want to reimagine healthcare education discovery to create value. To give you an example, we had 6 people running telehealth at another organization that came over to Jefferson when we had sort of our coming out party for that new model. And they said, I realized I could win the Nobel Prize for telehealth and health equity and not make it to the cover of the alumni bulletin where I am today, because I'm never going to help them get to be #1 in NIH funding, but I'm reimagining healthcare, and they came over. So you can start to send that message that you're different, but you have to be clear, right? I mean, you have to be clear to your own faculty that this is what we're going to be, and sometimes it's tough because people were used to a very different model.
You personally, Steve, haven't you taken on one of the tougher jobs that you could be tackling in this environment and your community? And I mean, it strikes me that this very human-focused, very patient-focused approach, working in an institution serving, that it's in a position to provide health equity because you're serving a community has not been provided with healthcare in an equitable way. But that sounds more difficult than going to parties at the NIH and being a really prestigious academic institution.
Yeah.
Does that ever occur to you?
Well, I get my fun stuff by, I'm a distinguished fellow of the World Economic Forum, so I get to hang out with the cool kids in Davos. So I do get some fun. But no, I think you're right. Look, you have to understand, I came here in 2013. We were a 2-hospital, 3,500 student entity with 3 different boards and 3 different people in my job. it took me, 6 months. I merged the university and the hospital together, which had never happened for 30 years. I created one board, and we've done 7 mergers in 6 years. And to your point, why did people merge with us and not our competitors?
Yeah.
Because we really set out a vision of what we called healthcare at any address. That, I said, if in 5 years, Elon Musk brings folks back from Mars to Philadelphia, and people say, where's Jefferson? I hope they can't answer that. I hope people say, what do you mean, Jefferson in my house, or Jefferson on my iPhone, or Jefferson at the African-American clinic in North Philadelphia or the Southeast Asia? Oh, do you mean the place where really, really, really sick people go to get transplants? I think that's still a 10th of Walnut. So we actually merged, this is an interesting story. We merged with the #3 fashion design university in the country.
Yeah, you told
A
me.
197-year-old academic medical center. And you might say, why? Well, the whole issue of the design of the human experience is what's going to be needed if you're going to improve lives. So the reason I say that is, as we started to get serious about it, and getting back to the leaders have to lead, I put 25% of my personal incentive at risk for reducing health equities in Philadelphia, none of which I have any control over. But I mean, I had to get out. So let me give you an example. Ken Frazier, the CEO of Merck, came to us. He gave us $5 million because he was born in 18th and Tioga, a very underserved neighborhood in Philadelphia. He recognized an African-American man who has a 30 times chance of getting a stroke where he was born than where he lives today, 9 miles away.
Yeah.
And he said, Steve, you're one of the few leaders I think will understand this. I want to give you $5 million to create a stroke center, but I don't want it to be at any Jefferson facility. I want it to be in this circle around 18th and Tioga. Well, it turns out that's in Temple University's territory. So we gave half that money to Temple. We're doing it as a joint venture. There's a donor that's been a friend of Jefferson for a long time that owns a strip mall right by where he was born. He gave us free rent for 10 years. And we're now partnering with Novartis to really have those zip codes going out to barbershops and doing that kind of thing. That's the definition of healthcare at any address. And when you think about why those places, Bryan, wanted to merge with us, even though some of our competitors are wealthier, that's a much better story of joining than I'd like you to be a spoke in my academic medical center hub and spoke system, which is what we traditionally say.
Well, I get it, that I get the attraction, and it sounds difficult, and it sounds extremely challenging. I mean, for instance, we have a question that just came in. How do you get input from frontline professionals? How do you get input from your patients? I mean, you're evidently working at customizing the healthcare delivery system for those people at the front line, both patients and healthcare professionals. What's the mechanism for bringing their perspective into your executive suite?
So I think some of this is, for me at least, it was actually doing something we don't often do. When I first got here, I literally did patient town halls. Almost the kind of thing that you see happening when you're doing a TV show pilot and you bring people in. Yeah. And I would say, it wasn't just tell me about your experience at Jefferson. And by the way, we would do it with people that came to Jefferson and with people that went to competitors. What do they do better than we do? You go to Penn, tell me what they do that you really like. Tell me what they do that we don't like. And we would do things where, we'd give out some iPads and that kind of thing. So there was a reason for people to do it. We would then write it up and send it out to, to all of our employees. I did a thing when I first got here where every week I would do a question. The first week I was here, I remember, because we had some issues when before I got here. But if you were the president, what's the first thing you do? And I sent it out to, at that time, we had 14,000 employees, all 14,000 of our employees, and beyond the sarcastic ones of I'd leave, what we do is take the 10 or 15 most creative answers, and I'd have lunch with those employees. And what was cool about it, Bryan, it might be the chair of neurosurgery and the environmental service worker midnight. I mean, it was a totally egalitarian type thing. And it was so cool because, the chair of neurosurgery said, hey, that's a really good idea. I had thought about that. The other thing that was really helpful, and I think for those that are involved in academic medicine, maybe this is where Lynn was getting to, but when I got here and I started talking about telehealth and healthcare transformation and, a 4-pillar model of innovation, strategic partnerships, along with academic and clinical pillar, at the end of the first year, I went through what I first said, and I said, so let me do a State of the Union. Here's the 5 things I said I'd do. These 2 have really worked out really well. These 2, God, I must have been on drugs. I don't know what I was thinking. What a disaster. And this one, we'll have to see how it works out. Well, I must have gotten, 10 calls and 50 emails, everything from chairs to other people saying, thank you. And it wasn't just that to them, I was the first president that ever admitted that they made a mistake in Jefferson's history, but the fact that that gave them permission as a chair or as a leader to go and say, look, this is what I've done right, and this is what I've done wrong. So, again, there are things that you can change culture, I believe, quickly. That was an example of changing culture quickly. The Jolt thing took 5 or 6 years to get that to that 40, 45, and 15. So, I mean, I think, and one of the chats here is exactly right. When we do these things, it's 100% listening. It is 100% listening to people, and some people choose when we do things and do them on Zoom to the patient pieces to do them through chat, but we don't try to answer it. We just say, what do you want us to hear? What do you want us to hear? And by the way, I ask patients that have a bad experience to email me directly, and they all get an answer. And that gets difficult, but they get an answer.
So when you ask them, what do you mean? If you're in the hospital and you meet a patient, or do you mean that the patients that just show up in your emergency rooms know how to email you?
Well, yeah, I made it clear this is how you can contact me. But one of the things that we've done, which is really cool, it was this technology thing, was at every bedside, we tell people we have this almost this thing on their TV that anything that's not going right, they can, and it could be that the room's too hot or whatever it is, or they didn't see the doctor. They can just press a button, do a little chat, and just like almost like the best customer services of, would you like to talk to me now? We'll either chat with them right away, or we'll send somebody up.
Seriously?
Yeah, and it's called the on-point system. And what's great about it is it's really helped things like our HCAP scores and stuff, because usually what happens is you do those things after they've left.
What's an HCAP score? Sorry.
Oh, I'm sorry. That's like what patients say about you and that kind of thing. It determines some of your value contracts and that kind of thing. But usually what happens is, you do these things after you have tell us about your experience. Well, then it's too late. Yep. Right? So, yep. But, I mean, what we get a lot now is, well, I was concerned the food was really lousy, or I needed halal food and, they didn't do that. But then I got on the on-point system and they immediately corrected it, as opposed to before we would say, well, the nurses were great, but they didn't get me the food that I had asked for, so I'm going to give you 3.5 stars instead of 5. Whereas now I'm going to give you 4.5 stars because as soon as I got on the on-point, they corrected it, and I think that's using technology to create a better human experience.
Does anybody within the organization resent the fact that the patients have so much power to communicate?
That's probably the administrative hospice piece. I mean, I think that, one of the things I learned at Wharton that's really stuck with me.
When you say Wharton, you're referring to Wharton Business School.
Yeah. I got my MBA there in '94, and the professor of leadership, the chair, a guy named Mike Useem, who's become a mentor, used to say, Steve, you should always have 5 people under you that think they can do a better job than you, and 3 that are right. That's really helped me because it's allowed me to round out our staff with people that believe, if you will, in the gospel of the patient-centered care, but that are much better at me. My provost, I've been a provost. He's a much better provost than I was. My head of my 14 hospitals is much better than I was, but I'm a damn good orchestra conductor and sort of leader of, I did my MBA thesis, Brian, on the difference in management styles between Captain Kirk and Captain Picard in the original versus the versus the Star Trek Next Generation. It was fascinating because
Can
there
I
were very
intuit? Can I intuit from your haircut that Picard is that you advocate for Picard there?
no, well, yeah. Actually, I'm much more of a Kirk.
Oh, really?
So if you think about it, Kirk was a sort of a charismatic visionary leader, but really wasn't that interested in managing, right? I mean,
True.
but I mean, the whole Family Guy type thing was I'm gonna go on a away team with Spock, Bones,
My friends, my buddies.
myself, and new Ensign Jones, and one of us isn't going to make it back. And Ensign Jones will go, well, I'm going to go, but I know that I am really in trouble. But they would follow him anyways because he was that kind of person. Picard was the best manager ever, but number one, who we used to call, really did more of the, talking to the kids and, when there was a problem. So, and that's okay. I think some of it, just like you preach in your mindful thing, is being able to look in the mirror and knowing what you're good at. I mean, at Jefferson, I don't go to any of our capital budget meetings or our integrated strategic financial plan because I'd be frankly worthless. And just to show up. I mean, they know where I want to head the starship. And in fact, they call it Jefferson Starship. But they know where I want to head the starship. But they're much better at me at getting us there. And then I'll look at it and say, yeah, that's great. But I don't think you put enough money in telehealth given where I think things are going. So it gives me a chance to sort of rudder it, but without trying. I think the worst combination you can be is somebody that is that kind of leader, but also wants to micromanage. And if you think back to Star Trek, for those of you who are geeks like I am, Kirk did not micromanage. Spock, McCoy, did almost all the managing, and he would do the end of show philosophic.
Right. I always loved the way Kirk managed technology. Is he would say to McCoy, he'd say, "I don't care how you do it, fix it."
Yeah, exactly.
That was it, right?
Yep.
You have to have work drive.
Yeah, and Bones was the the perfect doctor. Like, I'm a doctor, I'm not a mechanic. I'll do what I'm going to do. Just leave me alone.
Yeah, that's for sure. That's for sure. So, in light of all this, how are you doing? I mean, you're at 30,000 employees. You're in the middle of two mergers. You're going to be 52,000 employees here in the next month or so. That sounds like it might be a little hard on your health.
Yeah, I'm sort of I'm a bit of a AAA individual. I had a heart attack when I was 48. With no vessel disease. And they
just pure stress.
Yeah, their diagnosis was that you willed yourself. It was during another. So I think for me, it's honestly been, I've taken my own medicine of what is important to me as far as getting out. And it's running. I've run 10 marathons. I did a few virtual half marathons. In the middle of COVID, it's where I get my endorphins. I wrote 2 books during the pandemic, one with Hemant Taneja, the head of General Catalyst, the one behind me, but it starts out, what if a Silicon Valley entrepreneur and a CEO of a 197-year-old academic medical center walked into a bar, got married, and had a kid? What would that kid look like? So that was fun. I wrote another one called Bless This Mess, which this was really a lot of fun and probably took a lot of arteriosclerotic cardiovascular disease. It started with an illustrator. I gave a talk called Hitchhiker's Guide to the Healthcare Galaxy. What if the American healthcare system got admitted to the 2035 Intergalactic Council of Really Cool Healthcare Systems? So that was a talk I gave. What would we have to do between now and 2035? And there was an illustrator that, one of these young people that while you're talking does these amazing things and illustrates it. And in the corner, I never said this, but I must have said some mom 10 years from now is going to tell her kid what a mess American healthcare was. And she had this mom reading it to a kid, Bless This Mess, a picture story of healthcare in America. So 99% kidding, when she handed me this thing, I said, you and I ought to write this book together. So she was an underemployed illustrator. So 2 days later, she wrote me the contract for the book we are apparently writing together. It turned into this book called Bless This Mess, a picture story of healthcare in America. Warning, do not read this at bedtime. It's scary. So to me, those were releases of taking some of the frustrations around things like health equity, the number one reason that you would end up in the hospital or die from COVID in Philadelphia was not wearing a mask, or not social distancing, or not your genomics. It was your zip code, because all the things that we talk about, telehealth, online education, certain zip codes didn't have 78% of people didn't have broadband. So
Wow.
they were in virtual jail. Now, why would a city like Philadelphia that has 5 academic medical centers and is a home of Comcast have people in virtual jail? So it gave me a chance the things that made my brain explode, it gave me a chance to release in a positive way. I got in trouble for some of the stuff. The nice thing about writing science fiction novels, you can say almost anything. And you can say, well, that was that planet's minister of health. It wasn't really me. I was just the ventriloquist.
Are both those books available generally out there in the
both on healthcare and Bless This Mess. There's another one called Patient No Longer that I wrote with a guy named Ryan Donahue from the American College of Healthcare Executives. But I love thinking about what the revolution should look like. Wrote an article for The Economist. So at Davos in January of 2020, Brian. Now remember, that was like a month before the pandemic.
Right.
I was having a cup of coffee with the CEO of one of the big three finance things, and he had a great comment that really came back and made me think during the pandemic. He was saying, 30 years ago, the two sectors that escaped the consumer revolution were banking and healthcare. And he took a sip of his coffee and he said, now you're alone. and I was thinking about that, because think about that. For anybody my age, if anybody out there is my age, 30 years ago, if we had a pandemic, we would have been talking about you can only deposit your check every other week, because we don't want people lining up at the bank. We don't want people lining up at 3:45 p.m. before the banks close to get money or deposit their check. And what happened is 90% of banking went from being in the bank to being at home. My concept of healthcare at any address is that 90% of healthcare will be the same. So getting back to the people part of that, then we got to train people for that, right? So one of the things that I've been really excited about, where I've done a lot of my research, is we can't continue to accept doctors based on science GPA, MedCats, organic chemistry grades, and then be amazed that doctors aren't more empathetic, communicative, and creative. So we started the first medical school in the country where we chose students based on self-awareness, empathy, communication skills, and cultural competence. Interesting.
And the name of that school?
Well, it was at University of South Florida. We called the program Select. It was when I was CEO of University of South Florida. What's cool about that is we tripled the diversity. And why is that? Because there are people in Florida or in Philadelphia, they'll spend $100,000 for little Johnny or little Mary to get tutors and Princeton reviews to memorize the Krebs cycle. That's without even photoshopping, their picture on a lacrosse player. I'm talking about the legal stuff. And there's another kid that isn't as advantaged that might have a Battered Barron's book. And if you're going to choose kids based on can you memorize this stuff, there's no way that kid has an even playing field. And what's ridiculous about that is, 5 years from now, there's going to be a robot next to me. It's going to be much better at memorizing anything. So having a doctor that's self-aware, empathetic, culturally competent, and can communicate is much more important than having a 3.9, in science GPA doctor. So to me, those have been the things that I've learned from the pandemic that I hope to take away from this.
Well, it's been a great learning experience, hasn't it? And this conversation has been a great learning experience for me. If we have just a couple of minutes left, if anybody has a question, please put it in the chat during these next couple of minutes. I wanted to thank you, Steve, for the support you've given to Mindful and our efforts to bring mindfulness to as many people as possible. In particular, because you just don't strike me as somebody who's going to spend an hour a day meditating.
Well, it's fascinating because, you can imagine, I'm one of the few people that's been in both TechCrunch and modern healthcare. So I view myself a little bit as a horse whisperer, and I've, DJ'd Oliver Wyman events, et cetera. So a lot of incoming, because people think, I'm like that commercial remember that commercial? Oh, we got this new cereal. Who will eat it? Oh, let's give it to Mikey. He'll eat anything. So
Yeah.
anybody that has a new startup company, it's like, oh, let's send it to Jefferson. Steve will look at this. So I think one of the things that has been really important to me is really starting to think about where those things come together. And I've gotten really good at talking to people for an hour and getting a feel for where they're at. So when I spoke with you and Eric and Brenda, I did three things. I said, I want to be involved in this company because as online meets offline, the human in the middle is going to become much more important. And I felt what Mindful was doing was great. I read the book, and we're in the process, as is talking to my head of HR of, how can we start to evangelize, proselytize this, starting with my senior team that's been through some stress. And then I'm also a customer. I'm a patient. I'm working with one of your therapists. I was going to say it's like Hair Club for men, but that wouldn't be a good, that commercial of, and I'm also the customer. That wouldn't be a good analogy here. And I'm probably not a good analogy for meditating either, because you can probably tell from my hand motions, I'm not the calmest guy. But maybe when the person I'm dealing with from Mindful gets done with me, the next time you talk to me, I'll be much more mellow. I'll be talking slower. I'll be breathing in and breathing out. I'll say, can we just take 5 minutes off so I can meditate? But I still have some work to do. But she's optimistic that she said that she can beat anybody and anybody's AAA stress personality. So I'm going to hold her to it.
Yeah, we sent you to a real surgeon of mindfulness. I think that's what we tried to do anyway. Well, the main thing about meditation and mindfulness is knowing your own mind. And you strike me as somebody who's very well acquainted with his own mind. And you're using it for the benefit of a lot of people, something we should all be grateful for. Thank you, Steve. Thanks so much for taking the time and for what you do for Mindful and what you do for the world.
And Bryan, thank you. I think you've developed a great model, a great company. I think folks are ready to live their fullest life. And I think if there's anything that this pandemic has proven to all of us is whether it's professionally or personally, you need to live your fullest life. And just like you need a trainer for your physical piece, I think you need a trainer for this. So I think you're in exactly the right space. And what really hits me about everybody I've met from Mindful, and I'm a pretty good sifter, is that you guys believe in what you're doing, and it's you're building a great business and a great service for all of us. So thank you.
Yeah, thank you, Steve. Great to be with you and great to be with all of you. It's a great pleasure, and we're honored by your presence. Tune in again. We'll be back in a month or so. Diana Hahn, the Chief Medical Officer for Unilever, is joining us next month. Thanks, Steve. Thanks, everybody.
Take care, Bryan. Thank you.